In the last video that I did, I spoke about these putty sizes and that I used the little one for taking single tooth impressions. So I'm just going to show you that now and what I do and explain why I do it, the way that I do it. Now traditionally, let's just say that this is your partial denture that you're adding a tooth to. Obviously this is a chrome, but imagine it's not and it's just an acrylic, but with a tooth missing, the patient's had an extraction or something like that and you need to add a tooth to that denture. The traditional way to do it would be to take an alginate impression over the whole thing with the denture in situ and then take an impression of the opposing arch and then take a squash bite with wax for the patient, for the bite, so that we can add the tooth, so that the technician knows where the bite is basically. But the way I do it is slightly different. It's a lot quicker, simpler, more comfortable for the patient because you're not taking full mouth impression, and it's really quick as well. So you just get a little bit of putty, mix it as I show you in the other video where I talked about the border moulding with this material, where you're just turning it around, folding it in on itself. It's going to mix in a lot quicker because it's such a small amount. Mix it up. Imagine this is the patient's mouth. I take half of it off and I push it in all around that tooth area like that, and then I'll get the other bit and I put it on the top and then ask the patient to relax. Never tell them to bite because they do all sorts of strange things. Just tell them to relax their jaw and slowly close together. Now these models didn't go together, so it's not right. This is just for also it's demonstration purposes. When it's like that, then you just push it into the bite around that area and then we wait for it to set. And with the magical power of editing, it's already set. So then you get the patient to open and it will come out like that and then like this. We take this out. This is the bit where you have to be careful because you want this to stay attached to the denture. Now again, in one of the other videos I said I don't use silicone glue. In this situation I do use silicone glue. I didn't put any on this because this is just one of my one of my demonstration models and I don't want glue all over it. But in this sort of situation I will use a silicone glue so that this sticks to this denture. And when you take it out of the mouth, this bit ideally needs to stay on. If it doesn't stay on, it comes off. You just need to clean up any bits that are loose and then put some silicone glue on and just glue it back into place. But ideally, like this, it's locked in quite well. And now you can send this to the laboratory, and what they'll do, they'll cast that there, and then they'll make a matrix with this bit. Okay, so cast that. This will be in a normal model like usual. When that plaster's set, they put another blob of plaster on the top. They put some sealer. And then this section will just come off. You can take away that. Now this is on the model, and the little matrix that they've got, they can just put it on, which will represent where the teeth are in that area. And now they can just get a tooth, trim it to shape, cold cure it in with the bite and the teeth in the right occlusion. It's a nice quicker way of doing it. It takes a few seconds. Patients prefer it. You haven't got all the hassle of mixing up loads of alginate. The results are really good as well. Like, you can get a really accurate bite with this method rather than using wax squash bite. I have got some views on squash bites. Always do wax. This is the only time when I would register a bite with silicone. And the reason for that is because let's imagine that you've taken this impression in the patient's mouth and it's their natural teeth, and then you've taken an impression with alginate of the patient's natural teeth. You cast that up in plaster. This is silicone, and then when the technician comes to articulate, as he puts them together, they won't be exactly the same because the alginate impression will be slightly different than the silicone, and so it will bounce. The two won't go together properly. They'll bounce, and so that bite, doesn't matter how good the technician is, there will be a discrepancy there somewhere, and it affects the bite and the way that it goes back together. Now there are things that you can do, so you can trim it right down so you've got the minimal amount of contact to try and get that stable, but then it makes it difficult to articulate. In this situation, what we're doing is we're casting the plaster directly into the silicone, so even when we take it out, if we was to put it back in, it'd go in exactly because it's the same impression. So never use silicone based bite registration material unless you're using it for something other than bite registration. I use it quite often for all sorts of things, and one of the things is actually to do this. So another way of doing it, instead of using putty, you can literally just use your bite registration material. It's a little bit more tricky to do, and the problem associated with this is that it's sort of quite runny, and so it can flow and the patient can push it out of the way with their tongue. And when I've done that, instead of pushing it up, I'll obviously just squeeze a little bit more on there to register the bite, make sure I've got the occlusion in the right place. This sets much quicker than that. So where you're waiting a couple of minutes for the putty to set, this will set a lot faster. And by the way, this is the Imprep one. Imprep bite registration material. Sets really quick. The downsides of using this over the putty is it's a little bit more difficult. As I say, it's got a little bit more flow, and so it's a bit more, yeah, trying to get it in the right place and getting it to stay where you want it to stay is more difficult. But I will use it in certain situations where I need it to set really fast. Let's say maybe a bit of acrylic has chipped away rather than a tooth that's missing. It could work in certain situations like that. The other thing that you can do is you can put it on there, and then you can put some of this putty in as well to displace it. And the other thing with this set's quite flexible. The putty set's quite flexible, but the bite registration material, it sets firmer. It's not completely set yet, but it's got less flex to it, and so it's more likely to tear. Now that can be an advantage as well. So it might be that you've got a really deep undercut in there, and so you don't want it to tear when you're taking that out. So in that sort of situation, you'd use the putty. But if you've got a situation where you would rather it tear, let's say that the tooth is a little bit mobile or something like that, it may be advantageous to use this material. It tore really easily, and we didn't get a great impression of the occlusal surface either, because it's so soft, and the fact that it tears easy can make it a little bit more difficult for the technician as well. I only use that for certain situations, but it's a good tool to have in your arsenal, the bite reg material, but not as bite registration material. Okay guys, that's it for this one. Let me know if you have any any questions or anything, put it in the comments below. I'll be more than happy to address any questions.